So the abstract 55, which is the results of the manifest study in cohort 3, these are patients with advanced myelofibrosis that are treated with a combination of CPI 0610 and oral pan-BET inhibitor in combination with ruxolitinib in patients who've not received prior JAK inhibitor therapy. So these are treatment naive patients, is the subject of this discussion. And what we saw in this study, which was a single-arm cohort study of these patients who are JAK inhibitor naive, were responses that appear to be higher than what one would expect from historical studies like the COMFORT studies, or even Simplify 1, in which momelotinib was compared to ruxolitinib. So spleen responses, and SVR 35% is the hallmark at 24 weeks, was 67% in the combination CPI plus ruxolitinib regimen. The symptom response, 50% reduction, was 57% of patients. This is pretty significant numbers. If you look at the waterfall plots, the majority of patients enjoyed some degree of both symptom and spleen benefit with combination therapy. Additionally, almost a third of the patients had a reduction in bone marrow fibrosis with the combination therapy, and somewhere around 20% or so patients developed transfusion independence. If you look specifically at the patients who had anemia at onset, who were transfusion independent, you can see the mean hemoglobin level increased over time, suggesting that the combination of these two drugs that has rationale from preclinical studies limits the degree of anemia and even potentially thrombocytopenia that is seen with both disease and therapy-related effects from JAK inhibitors like ruxolitinib. So it was exciting to see this data play out in a large cohort of patients across multiple centers, and has inspired the